Studies expect that there will be a shortage of 3.2 million healthcare workers by 2026. This has been a growing trend for years, peaked by the COVID-19 pandemic. The quality of healthcare has diminished over the years, and staffing shortage has been a significant issue in nearly all healthcare facilities. I've worked in healthcare for a year, and I've personally seen the issues within healthcare. Most of these issues are due to staffing shortages. Healthcare is of wide importance throughout the United States, yet healthcare has seen widespread staffing shortages. These shortages are due to the COVID-19 pandemic, working conditions, and burnout. The COVID-19 pandemic has put a burden on all areas of healthcare. At the beginning of the pandemic, many clinics either shut down and were converted to COVID-19 referral centers or testing centers. Telemedicine became more frequently used, limiting the need for many healthcare workers as patients were not being visited inside facilities. Other facilities, such as hospitals and long-term care centers, also reduced staffing to limit the spread. According to healthcare science reports, patients have a difficulty reaching the hospital through ambulance, and those with a chronic disease would rather postpone their follow-ups. Outpatient hospital activities were limited due to urgent cases, and all scheduled activities were interrupted. Long-term care facilities, housing residents with declining immune systems and chronic systems, faced extra challenges, as exposure to COVID-19 led to fatalities on a large scale. An infection control nurse I have worked with stated that, despite their best efforts, the number of residents in their facility decreased in half during the first year of COVID-19 due to declining age, expected health issues, and decreased admissions for fear of bringing COVID-19 into the facility. The cutdown in staffing and reduced patients in certain areas have caused continued limited staffing. Facilities trying to hire more staff are still having difficulties doing so. In addition to the COVID-19 pandemic, working conditions raise turnover rates and contribute to large staffing shortages. Working conditions expose healthcare workers to dangerous situations, which can lead to stress and eventual turnovers, which is the individual seeking a new job. According to the CDC, the percentage of healthcare workers who reported experiencing harassment more than doubled, going from 6% in 2018 to 13% in 2020. The CDC also states, in 2022, 78% of health workers agreed or strongly agreed that they trusted management, compared to 84% in 2018. The declining trust in management can put a burden on healthcare workers, leading to stress and potentially causing them to seek out more trusted positions. Another statistic listed by the CDC states, in 2022, the percentage of health workers who intended to look for a new job increased to 44%, up from 33% in 2018. Combined with working conditions, burnout is also a significant factor in stress in healthcare. Burnout has been a major cause of short staffing, leading many healthcare workers to become stressed to the point of leaving their jobs. According to the Center for Disease Control and Prevention, in 2022, 46% of health workers reported feeling burned out often or very often, compared to 32% in 2018. As a healthcare worker myself, there have been times where I've experienced burnout. With call lights lighting up the halls, it sometimes seems that there's not enough time in the shift to take care of everyone's needs, then chart it, and then take out the laundry and trash, and wait for your replacement before you can finally go home, with barely enough energy to change out of your scrubs and brush your teeth before crashing the second your head hits the pillow. According to the National Library of Medicine, approximately 1 in 3 physicians is experiencing burnout at any given time. This may not only interfere with our own well-being, but also with the quality of delivered care. Healthcare has overall experienced significant causes of short staffing. COVID-19 has led to forced diminished staff due to limit the spread and scare people away from medical facilities. Working conditions have exposed healthcare personnel to violence, illnesses, and other challenges, causing many to decide on a different career path without such conditions. Burnout has made it difficult for some to complete daily tasks and burden their personal lives as well. In conclusion, each factor has led to a shortage of staffing in healthcare in significant ways. While attempts have been made to improve and restore conditions, there is still a long journey before healthcare staff returns to pre-pandemic levels.